Good morning, everyone. Afternoon, evening. We'll wait for 2 more minutes before we start the webinar. At this point, you can make sure that functionality is working. Hopefully, you can listen to me. If you are not able to listen to me, if internet connection is not good, you can leave a message in a chat box. Very nice. I'm getting responses from some of you that everything is working out well. Good morning, good afternoon, evening. Thank you all for joining for the webinar on silicosis crisis. And the title, Edge, Why Are We Still in It? An Australian Perspective. My name is Maharshi Mehta. I'm president of International Occupational Hygiene Association, and this is the webinar of the webinar series that we do every month. Just want to let you know that we offer this webinar, this type of webinar every month, and typically for 1.5 hour duration. These webinars are free to all the members of IOHA Association. And if you are not member of IOHA Association, there is a nominal fee, which I'm sure you have paid it. With us is Rita. Rita is Executive Secretary at IOHA. She has been the pillar of the IOHA. She has been supporting us in what we are able to do. Before we begin the webinar, let's make sure that the functionality is there. You all are able to listen to me, and you should be able to see me and Kate also. I'll be hiding my face once Kate starts. I would request you all to keep your video also in hiding mode, your audio also into mute. Later, there is a chat section, and in the chat box, you should be able to ask the question even now. Webinar is for 1 hour, and Kate will be talking for about 40-45 minutes, and then we'll have 10-15 minutes. And if we need 5 more minutes, we can spend 5 more minutes answering any questions that you may have. Let me introduce Kate. We are so much honored to have Kate as a speaker today. She is an engineer and scientist who has worked across some of the Australia's most iconic infrastructure project. She has a key focus on the prevention of silicosis um, through completion of the Winston Churchill Fellowship, and her work across major construction and tunneling projects both in Australia and internationally. And I'm sure we are aware that all the mining activity and some of the construction activity has a high potential for silica exposure and the potential for silicosis. Kate was named by the Australian Financial Review as one of the top 100 women and of influence for her work in crystalline silica dust control, and is one of uh, one of the science and technology of strange substance of STEM. Maybe Kate can talk more about this thing for her service to workplace health and safety, Kate was awarded, this is the most significant accomplishment, a Model OAM of the Order of Australia and included in the COVID-19 honor roll in the 2022 Australia Day honors. These are all significant accomplishment what we can do in our profession of occupational hygiene. So thank you, Kate, for taking time to share your experience with us. And with that introduction, may I request Kate to start her presentation, please?
Absolutely. So thank you so much for that introduction, and welcome everyone this evening or this morning or this afternoon, wherever you are. Thank you for coming into our Australian time zone. For our international guests, we're very well versed in coming into your time zone, so I apologise in advance if it is the middle of the night for you. So I might just start off with an acknowledgement of country. For those outside Australia, an acknowledgement of country is a formal statement that a public event is taking place on land originally inhabited by our Indigenous peoples. So I would like to acknowledge the Aboriginal peoples as the traditional owners and their custodianship on the lands in which we meet today. We pay our respects to their ancestors and their descendants who continue cultural and spiritual connections to country, and we recognise their valuable contributions to both Australian and global society. So I thought I'd just start off with who we are. I know we have a lot of members from the IOH here, but for the benefit of our international guests, the Australian Institute of Occupational Hygienists was established more than 40 years ago in 1980. It is the peak organisation representing professionals working in occupational hygiene in Australia, and membership to the AIOH is open not just to occupational hygienists, but anyone with an interest in worker health protection and indeed a healthier work environment. So we are the largest organisation representing hygienists. We have around 1,300 members at the moment, but it keeps growing every year, which is great. And we have about 200 or so certified occupational hygienists. Just a little bit of a plug for 3 main programs, and I'm going to talk about one of them this evening, which is Breathe Freely. The Breathe Freely program aims to prevent dust-related occupational lung diseases such as silicosis through education and awareness of safe work practices to control exposures. Another program we have, which we're really proud about, is RESP Fit. It's a national respiratory protective equipment fit testing, training and accreditation program. And we have the AIOH Foundation, which is a charity that awards small grants to advance knowledge and practice of occupational hygiene. So that's a little bit about us, but I'm going to get straight into it. So this is the face of Australia's silicosis crisis. This is Anthony White. He was a stonemason from the Gold Coast in Queensland in the north of Australia. Anthony died of accelerated silicosis in March 2019, and he was aged 36. He died from inhaling high concentrations of respirable crystalline silica, and he became the unfortunate face of the many men who have since been diagnosed with silicosis from engineered stone exposure. But unfortunately, it's not just Anthony White and it's not just artificial stonemasons that have been killed through silica overexposure in Australia. Just a few weeks ago, for example, the New South Wales government, which is the state that I live in New South Wales in the southeast, reported that there were 23 workers who have silicosis from tunnelling work in this state just in the past 5 years. So you might be asking yourself, how does it happen that in 2019, when this photo was taken, or indeed in 2022, that we have workers in a first world country like Australia dying from this disease? Well, to understand that, we need to go back in time a little bit. We know that accelerated silicosis develops within 10 years of moderate to high level exposure to silica dust. So let's go back and look at what happened in the 10 years or so before 2019 in Australia. Well, I might just start with 2 years before that, in 2017. This is an excerpt from the webpage of our work health and safety regulator in the state that I live in, New South Wales, in 2017. And I pick on my own state, but it wouldn't have mattered which website I chose in any state or territory in Australia. They all said pretty much the same thing. And I'll point your attention to this. There's a statement when workers or employers go to our work health and safety regulator and go, what is silicosis and is it a problem? And that statement in 2017 said such exposure is extremely unlikely nowadays given work practices. So why didn't our work health and safety regulators think in 2017 that silicosis was a problem? Well, to understand that, you need to understand the many gaps that existed in our legislative and operational government frameworks at the time. So let's go back a year before. In 2016, I undertook a Winston Churchill Fellowship to look at best practice to prevent illness and disease in tunnel construction workers. And at the time, I spent much time documenting the gaps in our work health and safety frameworks that enabled silicosis to happen. So, for example, back in 2016, we didn't have a centralised health surveillance scheme. So, records of workers with silicosis or indeed any silica related lung disease nationally. So, the disease prevalence was really unclear. We also didn't have any requirements or standardised training for silica dust for any workers or any management. So, how were they to know? There was, I would say, limited, it's probably kind, or inconsistent enforcement of legal standards, specifically around the workplace exposure standard for respirable crystalline silica as quartz. And there were very unclear levels of compliance with exposure standards across the country. We know what this means. Financial pressures in business meant health was getting pushed down the queue a little bit. And when it comes to air monitoring, in some cases, air monitoring was being done, but at different frequencies and by different people and different methods across different industry. It wasn't standardized. And unfortunately, in 2016, and still unfortunately in 2022, if an occupational hygienist collects a sample of silica dust or respirable crystalline silica, personal exposure monitoring, and that result exceeds the workplace exposure standard, then in industries like engineered stone and construction and tunnelling, they don't have to tell anyone. In fact, there's no legislative requirement for the employer to notify anybody, which is a problem. There were also no minimum mandatory levels of competency of those collecting samples or giving advice. And our law at the time, and still does, requires that risk to health be minimised so far as reasonably practicable. And that creates a level of subjectivity. And when the general knowledge of this hazard or risk is low, then when someone's doing a subjective risk assessment, they'll also think it's low. We didn't have national codes of practice, for example, or indeed state codes of practice on this issue. So at the time and still now, we have risk-based legislation, but risk was very subjective. The other issue was that not all workers who were at risk of silicosis actually got health monitoring performed. And I will say, even though it was a legal requirement, there was very limited sharing of lessons learned across industry, so no forums to share this type of information, and a really short-term focus mainly on safety hazards and items that result in acute fatality or killing them now was what employers were looking at, and not that long-term focus on the prevention of chronic health hazards. There was also no coordinated system with multidisciplinary representation to identify and communicate emerging issues from national or international literature, and that's exactly the same as it is now. And there was limited independent research, although we've got a little bit better recently. So in summary, in 2016, we had very basic legislation. We had a workplace exposure standard that employers were not allowed to, under legislation, to exceed, which is 0.1 milligrams per cubic metre of silica as quartz. But many companies actually weren't measuring or enforcing or doing anything about it. They weren't using that workplace exposure standard for anything. And health monitoring wasn't getting done, so workers didn't know they had silicosis. And when health monitoring was getting done, there was no centralised register to record that event or to alert the regulator. And little, if any, workers' compensation claims, were happening. So really, no one thought that this could happen. So our work health and safety regulators didn't get or have data or knowledge of the extent of non-compliance from inspections. They didn't have knowledge from workers' compensation data. And so I guess they just assumed that it wasn't a problem. So there was no systems in place to ensure that that information was getting to them. But it wasn't until 2016 that the first case of artificial stone-related silicosis was reported to regulators by concerned physicians. As I said, that was the same year that I was awarded my Winston Churchill Fellowship. Moving away from engineered stone and into tunnelling, I applied for my fellowship because I knew many tunnellers with silicosis, and I could only see it getting worse. Because in 2016, I'd calculated that we were going to tunnel further in the next 7 years in Australia than we had in the past 2 decades. We were heading for an infrastructure boom. And my concern was that we were also heading for a silicosis epidemic in tunnelling. So myself, along with many others, were doing our best to sound the alarm on the prevalence of silicosis in tunnelling, as not much was happening. And just to pause for a moment, it's been 6 years since that time, and while much improvement has been made in that sector, it still has a long way to go. As I said, 23 workers have silicosis from tunnelling work in this state just in the past 5 years, and that's just what's been reported. But why is that? Well, personally, I think it's a shame because many, including government, should have known that it was coming because we have had this problem before. In 2005, in Australia, there was a Senate inquiry into toxic dust. The inquiry was prompted by a gentleman named Richard White, and he was a financially uncompensated sufferer of occupational lung disease. He worked as a sandblaster, cleaning barges and fuel tanks, and he initiated a compensation claim in the Northern Territory, which is an area north of Australia, in the Northern Territory Supreme Court. And he alleged that his employment resulted in developing silicosis. So he actually lost the first trial. The subsequent appeal to the Supreme Court of the Northern Territory and an appeal to the High Court of Australia. But he didn't give up. He underwent an open lung biopsy, which concluded that he had industrial-related silica injury to his lungs in the form of interstitial fibrosis, small airways disease, and emphysema, giving rise to mainly fixed airflow obstruction. Mr. White then placed a newspaper advertisement requesting people to contact him who knew or suspected that they had acquired lung or other diseases through working for companies that use sandblasting techniques. And he obtained over 900 names. So the key findings into the inquiry into workplace exposure to toxic dust were that disease associated with workplace exposure to toxic dust continued to be much greater than revealed by numerous historical inquiries or reviews, that latent disease periods meant that the actual incidence and the prevalence of workplace injury from toxic dusts remained largely unknown, that workers' compensation data was limited in scope as it didn't record work-related illness that was less than 5 days duration and didn't record unsuccessful claims. It concluded there was low enforcement of regulations and low levels of awareness. So the Australian government responded to the recommendations 3 years later. There were a total of 14 recommendations made. And with regards to silicosis, they can be broadly grouped into 4 main key areas, which were to establish mandatory reporting, improve health monitoring and ensure this data was readily available, to increase awareness across medical professionals and industry, to increase the enforcement of regulations, and to increase the number of occupational hygienists employed by regulators. There were also recommendations around establishing improved national compensation mechanisms. Unfortunately, these weren't actioned. That's why there was no workers' compensation data. That's why there was no or limited or no enforcement of the workplace exposure standard or the related regulations. The federal government at the time essentially said, thanks, but no thanks. Silicosis was a disease that was not reported and it wasn't measured. So if a worker was diagnosed with silicosis by a doctor, that event, that statistic, it didn't go anywhere. We can't say that in 2017, 710 new cases of the disease were recorded across Australia and 175 of them were in the state of New South Wales, for example. But we can do that for asbestos-related diseases because that statistic I just read to you was obtained from the Australian Institute of Health and Welfare website for mesothelioma, an asbestos-related disease. We know that if a disease is not measured or recorded or reported, that it easily escapes public and regulatory attention. But perhaps you're very forgiving because you think this is the first time our government has dealt with this issue. Well, not exactly. There were numerous calls for mandatory reporting of diseases such as silicosis starting in the 1920s. Mandatory reporting was recommended again in the 1950s by the Royal Australian College of Physicians and again in 2005 as part of the Senate inquiry into toxic dust. Now, this response came in 2008. And I will point out here that Caesar Stone, the very first company to import engineered stone benchtops into Australia, established in our country in 2001. Exposures to silica dust were already happening by the time of this government response. But the truth is that we've been dealing with this carcinogen in Australia for hundreds of years. It's taken the lives of thousands of Australians, starting with the turn of the last century. So in Australia, sandstone is the earliest source of the silica dust that caused silicosis in the 1800s and the early 1900s. And that's because it contains really high amounts of quartz, over 75%, sometimes 90% quartz. And we know when that quartz becomes a fine dust, then that is silica dust. So silicosis at the turn of the century had a very high fatality rate. This photograph from 1902 shows that out of a group of 30 men, 16 had died within the past 7 years. But that was then. So what does it look like now in Australia? Well, Safe Work Australia, our national regulatory policy body, trying to find a way to explain it to people outside of Australia. Safe Work Australia recently published these statistics from accepted workers' compensation claims for silicosis. And I will say they only relate to states and territories that are subject to what's known in Australia as the harmonised or the model work health and safety regulation, which means, in simple terms, it only represents states that all agreed to adopt the regulation. Unfortunately, one of our largest states, Victoria, isn't included in these particular statistics. So this graph isn't representative of all Australian workers' compensation claims. It also obviously misses workers that don't seek compensation, but might seek damages under common law or don't seek any compensation at all. And you can see the huge spike that happened in 2018 and 2019. But arguably, these cases of silicosis were happening well before then. This is what it looks like in Australia across the various industry sectors. Manufacturing and specifically manufactured stone is leading, closely followed by construction, which includes tunnelling, which for context for those internationally is unfortunately not regulated the same way as mining, but tunnelling in Australia is regulated the same way as construction. So performance-based, very loose. Silica exposures in construction and mining are mainly from quartz in natural substances like sandstone or the host rock or the use of concrete, for example. But silica exposures in manufacturing are from an imported product to Australia, which is engineered stone. So what is the real or expected current extent of the problem? Like, how big of an issue is this really in Australia? Well, based on the levels of occupational exposure to silica dust in Australia, a recent study published by Curtin University predicted that more than 10,000 Australians will develop lung cancer and up to 103,000 workers will be diagnosed with silicosis as a result of their current exposure to silica dust at work. So in summary, this is a very current and a very large problem. So now I'm going to take you through what's been happening in Australia since 2019, because a lot has happened. In July of 2019, the Australian government established the National Dust Disease Task Force. And that task force had to really start to understand what the issues were with the re-emergence of silicosis, what were the emerging trends of accelerated silicosis among workers in the engineered stone industry, what was actually happening. The task force was highly consultative. It went through a period of consultation with lots of groups, including health and medical professionals, including professional bodies, including the IOH and union and worker representatives as well. The task force released its interim advice in December 2019, and it included a lot of early recommendations, which was really great. They focused on awareness campaigns because people really didn't know how big of a problem this was. So just getting the information out there was a huge step forward. They focused on the work needed to, or recommending the work needed to be put in place to build a disease registry, to establish a research collaboration forum, to develop national guidance and a strategic national approach to detect and respond to future emerging diseases of significance, really pointing out that the current way that our work health and safety frameworks are structured in Australia wasn't enabling that to happen. And astute listeners will pick up on the fact that not really any of these recommendations dealt with the source of the problem or focused on prevention. Around the same time, Safe Work Australia started a process of consulting to reduce the workplace exposure standards. So Safe Work Australia, government statutory agency, develops national policy on work health and safety, and then it's promulgated by each state and territory in Australia. So in 2009, Safe Work Australia published their intent to lower the workplace exposure standard to 0.02 milligrams per cubic metre. For context, the previous standard of 0.01 milligrams per cubic metre had been in place since 2005. Before that, it was, it should be 0.1 error. Before that, it was 0.2. In July 2020, what happened was that it was actually changed to 0.05 milligrams per cubic metre. I'm going to share a little bit later on in this presentation some feedback from occupational hygienists in workplaces right now around the level of compliance with the exposure standard currently in 2022. But from my experience as working in as an occupational hygienist in 2019, and indeed many of my colleagues, pretty safe to say the workplace exposure standard wasn't even seen as a maximum limit. It was seen as more of a guide. So the final report of the National Dust Disease Task Force was released in 2021, middle of last year. These were many recommendations from strengthening health and safety measures, so like the law, legislative frameworks, for example. The need to give greater priority to work health and safety monitoring and compliance activities by our regulatory authorities. The third is to conduct a regulatory impact analysis to decide on the implementation of measures that provide the highest protections to workers. So again, legislative reform. The fourth was to commence the process to implement a full ban on the importation of engineered stone. So really getting to the crux of the issue, the source of the problem. The next one was to improve the quality, frequency and coverage of health screening. There was an item in there around finalising and implementing a national silicosis prevention strategy, which is a huge volume of work I'll speak about later, which it has been going on this year. There was a recommendation around communication and communication stakeholders, the need for early detection and rapid response protocols, better support for ill workers and better support for health and allied professionals. Again, the development of a national registry was raised. And lastly, the establishment of a cross-jurisdictional governance mechanism to improve communication and info sharing, generally recognising that we don't have those great structures in place in Australia, which enables diseases like silicosis to continue throughout our country, unfortunately. But these were all recommendations. The National Dust Disease Task Force weren't a legislative or statutory body. They could just make recommendations. So they weren't guaranteed, or they're not guaranteed to be implemented. Very similar to the Senate inquiry into toxic dust, there was a whole series of recommendations and some weren't implemented. Well, that was the fear about the recommendations from the National Dust Disease Task Force. So the Australian government, all of government response came out in March of this year, and thankfully it supported at least 14 of the 16 recommendations of the task force, but 2 of them were only noted. And the one recommendation that would have gone to the elimination of silicosis in the engineered stone sector, unfortunately wasn't supported. So they didn't support commencing the process to implement a full ban on the importation of some or all engineered stone products by 2024. And they only noted the need for better support for medical, health, or other related professionals. So the government did note that substantial work had been undertaken by Commonwealth and state and territory governments at the time to really put additional recommendations in place and to try to address the incidence in silicosis cases amongst engineered stone workers. They noted that jurisdictions would have to continue to take action, so sort of develop their own action plans and work on it within their own states. And they noted that a ban would only be considered if there were no measurable improvements in compliance or preventative measures proven to be effective. And they said consideration of a ban would require Commonwealth, so federal, state and territory governments to all work together to develop a framework to evaluate the effectiveness of compliance with health and safety duties and the effectiveness of measures to protect workers, including any measures that may be needed following the regulatory impact analysis process. They said that any decision to ban engineered stone products would be dependent on an objective assessment of the requirements established under the framework, noting that they might need more time than just 2024. So I'll summarise all that and say that the Australian government, their response has essentially enabled employers time to comply with the regulations before cutting them off completely. I completely do not agree that this is a good idea based on our history. The highest level of protection to workers in the hierarchy of control is the elimination of the hazard. The reasons provided for not including a ban in this document, in my opinion, is poor. So notwithstanding the lack of a coordinated response across Australia, there have been some recent improvements into the way that we manage silicosis in our country. So here's a quick summary. We've implemented a workplace exposure standard that's lower, so 0.05 milligrams per cubic metre across states and territories of Australia. There is a regulatory ban on the uncontrolled dry cutting of engineered stone. So what that means is that there needs to be a continuous stream of water or other methods. You can't just grab a hand tool and dry cut engineered stone. Well, at least you can if you want to comply with the law. So it really depends on the employer's aptitude or want to comply with their legislative obligations under the Act. We've seen licensing schemes for engineered stone come in Victoria, for example, which are fantastic. And licensing schemes set a level playing field and like a license to operate for engineered stone companies. So I'll pause here and say engineered stone companies are small. So small to medium enterprises, they might only have like 4 to 10 workers in each one of these companies. And you compare that to mining or construction when there's hundreds or there's thousands of workers for each area. It's a completely different demographic. So it's also harder for the regulator, I would imagine. Must be really resource intensive to have to go out to so many different companies to check compliance with legislative requirements for engineered stone. So having a licensing regime, so sort of a positive duty for employers to demonstrate that they've met a minimum standard before they can even operate, is a really good thing. We've seen new codes of practice or compliance codes, depending on the state in Australia, that target engineered stone. We've seen new state lung disease registers. So in the state of New South Wales, we see an annual report which outlines how many workers the last financial year were diagnosed with silicosis, for example. And, if I reflect back on what was published, I think it was at the financial year, so up to June 2021, I think almost half of those workers from memory, as reported in the New South Wales Dust Diseases Register, were from outside of manufactured stone. So this is a bigger issue, as I've mentioned before. In some states, they've implemented low-dose high CT scanning instead of chest X-rays. Some states have implemented new amendments to regulations, so making it a bit more prescriptive and a bit clearer for employers on how to comply with the Act. We've seen a lot of health screening of workers in manufactured stone, which is good, because the more the regulator goes out to high-risk companies, the more information they obtain about levels of compliance, the more they're helping workers, the more they're helping employers, the more we have a really good understanding of the state of the problem. That also goes to regulatory workplace inspection campaigns. So we've seen a great increase of those across the country. We've seen a lot of awareness campaigns from our health and safety regulators, and we've seen some case finding studies, so some proactive studies to try to find and triangulate data from different sources to see, well, what is the actual extent of the problem? But I'll just note again that even though there's lots of improvements, they're not consistent across the whole country. It depends what state you're in. And unfortunately, we have the circumstance in Australia that some workers are better protected in other states than they are in others. So I want to pause for a moment and explain what we have been doing at the IOH to support the need to get traction on this important issue. In 2019, we launched the Breathe Freely Australia campaign with resounding success. It's a lung disease awareness campaign. It included us going out and partnering with lots of allied stakeholders and kindred associations. It helped us get the message out there to where it was needed the most, and it helped us establish a website or a holding place for all this sort of information that was targeted to workers and employers, not just targeting our own, so occupational hygienists. And we were really fortunate and very thankful to our friends at the British Occupational Hygiene Society for gifting us this program and enabling us to make it our own. So as I mentioned, it's an initiative to protect workers from dust-related lung disease. When I was doing my Churchill Fellowship in 2017, I had the great fortune to go and witness how the BOHS runs their Breathe Freely program and the fantastic impact it has made. There's a very large focus on silica in the construction industry. There's also a focus on welding fumes also while you're there, which is another big issue that we have in this country. But it's a fantastic resource, no matter if you're a worker, an employer, a health and safety professional. There's lots of great information there on hazards prevention and protection. So just a little plug if you haven't seen it before, some great information there depending on the industry that you're in and also dependent on the occupation that you may be in as well. So I've actually done quite a bit at the AIOH, so I am proud to say I struggled to get it all on the page, so I'm just going to go through some top level things that we've done. Apart from launching Breathe Freely, we also launched RespFit, our national respirator accreditation training program, actually right in the middle of the COVID-19 pandemic. But RespFit goes to really helping workers that rely on respiratory protection, close face fitting respiratory protection. We know that respiratory protection is only effective if it's worn correctly. If it's close face fitting, it must be fit tested. I've worked in the tunneling industry for a very long time, and I still remember trying to implement a respiratory fit testing program on the first tunnel project that I worked on. And now, all these years later, it's just the way that business is done. You can't go underground until you're fit tested. So the industries have come a long way. We reviewed our position paper on respirable crystalline silica, and we've republished it with the latest evidence. We worked with NADA, which is a testing authority in Australia, because we recognise that there are some technical measurement issues with measuring silica at very low concentrations, and we wanted to make sure that our position was really clear and the position of NADA was really clear, so we wrote a joint statement outlining all those issues. So hopefully we can get some research and we can get some work into this, because we do want silica dust exposures to be as low as possible. We're not content with any exposure, we want it to be low. We've contributed to many consultations during this whole process, whether it was the National Dust Disease Task Force. Safe Work Australia led a consultative piece around an occupational dust disease monitoring and evaluation framework earlier this year. And we helped support the preliminary development of the consultation regulatory impact statement, which is the document that went out that everyone is consulting on or has been consulting on what is the best, levels of safety protections for workers in terms of legislative reform. And we've made many submissions to inquiries. We've also written many joint letters and submissions to ministers because we want to see a ban on the importation and use of High Court's engineered stone. It is absolutely killing our tradies, and you just have to look at how slow we were at enacting a ban on in Australia on asbestos, and the many, many lives that were taken. We shouldn't have to go through this again to know that we were wrong. We need to ban that product. It's unsafe. We have worked with an organisation to review and endorse their content on a nationally accredited course that's targeted to workers on crystalline silica exposure prevention. And we're invited to be part of the National Silicosis Expert Steering Committee, of which I am honoured to be a co-chair. And that expert steering committee is charged with the development of the National Silicosis Prevention Strategy and the National Action Plan. So you might recall that that was part of one of the recommendations of the National Dust Disease Task Force. So myself and many others in that steering committee have been working to develop, and hopefully we will see the release of that really important document very soon, because it's all around silicosis prevention. The IOHA, we've been engaged in the registry build advisory group, so not just a register of disease, but a registry. We've done lots of media on the topic because we need to make sure this is front of mind to everyone else as well. While worker health is really important to occupational hygienists, it should be important to a whole bunch of other people also. And we launched an Australian first survey on the experiences of hygienists in silica management in workplaces, and we did that because we recognised that we had all of this peer-reviewed literature. We had so much evidence about why we need to prevent silicosis, but what we didn't have is independent research on what's actually happening in Australian workplaces right now in 2022. So I'm going to share that with you pretty high level. I will say it has been published in the Annals of Work Exposures and Health, so bit of a plug, you can go and download it and read it in your leisure time. So essentially it was a survey that went out to members of the Australian Institute of Occupational Hygienists, and it was done in March and April of 2022. The three largest or four largest states of where our members work, and indeed where industry is in Australia: New South Wales, Queensland, Victoria, WA. So it was great that we actually captured the right demographic. So occupational hygienists are scientists. We're not politicians. We don't lean to the left. We don't lean to the right. We're just scientists, right? We just want to make sure that we're got the latest information to help us make the best informed decision to protect worker health. So to see the scientists come to us and say the level of concern regarding overexposure to crystalline silica in April of 2022 is a 4 or 5, so extremely concerned, that says a lot. So we asked lots of questions around various things. One of them was the reported level of employer awareness on the risks of exposure to silica by industry groups. So we grouped them into three main industries. We've got engineered stone, construction and tunnelling, or mining and quarrying. So you can see with mining and quarrying, it's kind of in towards the right-hand side of the graph. So very high awareness, high, moderate. Mining's been dealing with coal workers' pneumoconiosis and silicosis for some time. You would expect them to have a relatively high level of awareness. But have a look at engineered stone. It's sort of in the middle to the bottom. Now, this is a sector that's had nothing but intervention put on it. And we still have employers with low or very low level of awareness of silica. Then that's really concerning. We asked hygienists, well, what's the level of non-compliance with the workplace exposure standard in your industry? Again, in mining and quarrying, nearly all of the exposures were less than the exposure standard with good controls in place, or some of the exposures exceeded. But then have a look at construction and tunnelling and engineered stone. It sort of goes towards the left. which is not where we want it to be. We asked hygienists about the effectiveness of regulatory intervention. So how effective are compliance activities by the respective work health and safety regulator in reducing exposures to silica dust? Mining, engineered stone, very effective. And then construction and tunnelling more in the non-effective area. It really speaks to resources that are within our regulators. It might sound I'm a bit down on our regulators. Our regulators are amazing. Each and every one of them are amazing. They do a fantastic job, highly qualified, very intelligent, know exactly what they're doing. I would just argue there's not enough of them. So we asked hygienists what the main barriers were to the prevention of silica-related disease in Australia. Top three were a lack of management commitment, a lack of financial resources for employers to bring in controls, and low compliance with existing regulations. They also identified lack of training, lack of awareness, lack of silica-specific regulations, and a lack of competence of people undertaking air monitoring and providing advice. We asked them about, well, what are the effective regulatory preventative strategies? And the largest that hygienists wanted was specialist inspectors with detailed knowledge of silica dust assessment and control. They also wanted mandatory reporting of exposure exceedances and awareness and education programs. So in summary, look, there were 4 options presented in the regulatory impact analysis by Safe Work Australia. They were number 1, it's on the left, like keep the status quo, don't do anything. The next one was to implement awareness and behaviour change initiatives. Then it was a national licensing framework, and then it was regulation. So what our survey showed was that the majority of hygienists are concerned about the overexposure of workers to silica. Air monitoring wasn't being performed appropriately the majority of the time. There was concerns for exposures exceeding and having the potential for higher exceedances, higher exposures. We found employer awareness was the highest in mining. There was a bit of a disparity in effectiveness of behaviour change initiatives, air monitoring, and the use of real-time monitoring. And regulatory intervention was only somewhat effective. And reporting of overexposures should be mandatory. So the main conclusion of that survey and the paper was that there is a concern. We need to move away from the status quo. We need to move into a strategy with an increased focus on controlling exposure and measuring how effective that is. And if it's not effective, report the exceedances so they can be followed up. And we need a nationally consistent approach to silica dust control across all industrial sectors. So the experience of hygienists told us that we need a regulatory strategy that is different, that looks at controlling and measuring exposure. So I want to just pause and sort of reflect on what is the position of the IOH now when it comes to silica dust exposure. This is a summary of a submission that we made to Safe Work Australia in the middle of this year on the consultation regulatory impact statement. And the number 1 thing that we said was that we need to ban the use of high quartz containing engineered stone. We need a Centre for Disease Prevention and Control or something like that. The current framework that our states and territories and our national system work in doesn't work. So we need a new system. We advocated strongly for a licensing framework. We need additional regulation. Yes, we need awareness and behaviour change initiatives, but to complement everything that's happening above that. We also pointed out that our amazing regulators need more specialist resources. They need more people. And some other things that we advocated on were the need for regulatory improvements to product labelling. Like stone is coming in, there's not even a label on it to warn workers that it's high quartz, for example. And we need some additional improvements to our health monitoring as well. So this is my final slide. I'll just reflect on where are we at today on the 25th of October, 2022. Well, we're still waiting. We're awaiting the outcome of the regulatory impact analysis. We're awaiting the outcome of the occupational dust diseases monitoring and evaluation framework. We're awaiting the outcome of the National Silicosis Prevention Strategy and the National Action Plan. And while there's been some improvements made to protect workers from silicosis, right now, on the 25th of October 2022, we don't have the right protections in place to protect Australian workers from silicosis. And we don't have the right structures in place either. So unfortunately, right now, the death of more stonemasons like Anthony White and indeed other workers in other industries is not being actively prevented in this country. So in summary, where are we today? We still have a long way to go. So thank you for your time, and I am very happy to answer any or all questions that you may have.
Good morning, Kate.
One second, if somebody has a question.
Yes, good morning, Kate. Myself, Aristides from Adnok, UAE. I have a
Hello.
question. Yeah, hi. I have a question. When you mentioned about Mr. White incident, that he published a news in newspaper about his incident, and he called for other industry peers to brief about the case. So is it legally accepted to publish such kind of notice in a newspaper and call for other colleagues, other industry peers to come? Because 900 cases he gathered about their exposure, you know. So such a
I don't
bold decision really.
I don't know if it's legal, but it's definitely bold, and it was definitely successful at raising awareness of the need for something as important as a Senate inquiry into toxic dust. I'm not aware of the law of what was happening in 2003, 2004. Yeah, so I don't know if I can answer your question on that one.
Yeah, I got it. But do the industry will share such kind of reports, medical reports, you know, for further investigation?
Yeah, Mr. White collected names and numbers of people rather than collecting their medical records per se. So things like the privacy of medical records, yeah, is definitely an issue. It's definitely not something that we share. So there is legislation around such privacy of such records in Australia.
Yeah, I got it. Thank you. Thank you very much.
Very nice.
Welcome.
Let's look at other questions. While I'm looking at the other questions, Kate, kudos to you. Kudos to you for the efforts of you and the AIOH in raising the awareness, in influencing the regulatory agency. It seems like what collectively you all have accomplished is phenomenal, which people from other countries can also use. In terms of think about Australia, now think add into this India or other countries where stone polishing and tunneling and other work is significant. Okay, I'll get back to more comments, but let's hear. We have thanks for the excellent webinar. I had this question. My question about this CT scan, is it recommended for routine health surveillance or for the diagnosis?
It's recommended for health surveillance for crystalline silica. So the initial health surveillance. So at the moment, well, particularly in some states, when you do health monitoring for crystalline silica, a worker will undergo lung function tests and a chest X-ray. And so this is about replacing that chest X-ray with high-resolution CT scanning. I believe Western Australia is the only state, I could be wrong, but it's at least one state that has implemented that in Australia.
Very nice. We have another question from Jake. Thank you for the presentation, Kate. In your opinion, is the drop in WS from 0.1 to 0.05 enough?
Oh, that's a good question.
I believe silica exposure. So the AIOH push for the proposed WES of 0.02.
It's a good question. So just to clarify, we believe that any exposure to silica dust should be eliminated or prevented, or should be as low as reasonably practicable. The workplace exposure standard is an upper limit. So just because you may have personal exposure monitoring that says 0.04, we don't say tick, it's fine. So, okay, well, what else can we do to bring that down so that it's not detectable? What else can we do? The issue with the proposed workplace exposure standard of 0.02, obviously when you shift adjust it, it gets even lower. One of the reasons that we co-published a position paper with the National Association Authority of Testing Authorities, NATA, in Australia, was on the limitations of sampling and measurability and analysis of quartz at those low levels. And I think sometimes that that paper or that issue gets muddied, where people will go, well, you know, you don't think the exposure standard should be, you know, any certain number lower than 0.05. That's actually not the case. If we could accurately measure workplace exposure, you know, to 0.02 shift adjusted, no problem. The biggest thing for us, which comes from the survey also, is that employers weren't complying with the workplace exposure standard previously. So having a workplace exposure standard of 0.1 or 0.05 or 0.2 is completely irrelevant when you're in an industry where workers are getting accelerated silicosis. We know accelerated silicosis doesn't come from exposures at the WES. We know that accelerated silicosis comes from exposures orders of magnitude above the workplace exposure standard. So sometimes these debates just detract from the most important issue, which is controlling the exposure. Put everything in place, everything you've got to reduce exposures to workers. It's one of the reasons why we're advocating for a ban for manufactured stone. Because sure, you can use water, sure, you can use you know, on-tool extraction, sure, you can use respiratory protection, but at the end of the day, there are safer alternatives, which is low quartz stone, and that's really where we should be focusing on the control.
Excellent. Question from Katba is how you compare the impact of the engineered stone to the other types of exposures?
It's a good question. So we know that engineered stone doesn't just contain quartz. We know that it contains resin. We know that that resin contains other metals. We know that engineered stone is qualitatively different to natural stone. So there is questions and indeed emerging research about the different extent of silicosis from engineered stone than from other sources, whether that's natural stone or that's cement or concrete, what have you. But in Australia, if we look at exposures to engineered stone historically, they were very high. So uncontrolled dry cutting using hand tools. So the worker is, you know, less than a meter from the source of, you know, pure, almost, you know, 99% quartz substance being cut into. So that is very different to a mine worker or a construction worker or a tunneling worker that is a little bit back from the source. Yes, there may be lots of dust, but the level of quartz in that dust is much lower. So from my understanding and reading the research, engineered stone is qualitative, and the exposures from engineered stone are qualitatively different to that from other quartz sources. Another reason why we're advocating for a ban of that material.
Great. Last question. Hi, Kate. When do you think we will be able to start reporting RCS exceedances for all type of industries?
I really, yeah, and she's talking about mining regulations being really strong. So for context for everyone internationally, in mining, if you report an overexposure to silica dust, it does get reported to the mining regulator, like within that framework, but in construction, in tunneling, in engineered stone, it doesn't get reported. To answer your question as to when, I certainly hope within my lifetime, I hope within less than a year. You know, these things have been brought up at numerous, you know, at the New South Wales Dust Disease Inquiry recently, and unfortunately was rejected by the state government because they're, you know, looking towards the national body Safe Work Australia to do their regulatory impact analysis before they do anything. And so it speaks to the really poor structure that we have in this country that stifles the ability to make such important progress. So I don't think I can answer the question, but I'll say we'll get there a lot sooner if we continue to advocate and really push this issue and talk about just how important it is that, you know, in 2022, workers shouldn't get exposed to a dust that will ultimately cut their life short. That's at the heart of it, what we're all here to do to at the end of the day.
Great. Is there studies which shows the effect of smoking along with exposure to RCS as what we have with asbestos?
Yes, there is. And one of, you know, once a worker has silicosis, apart from removing that worker from continued exposure to silica, one of the best pieces of advice you can provide if they are smokers is to stop smoking. That's really all you've got going. And yes, there is an effect, but you know, the extent of it, I can't really comment. You know, in my experience, I'm used to working in workplaces historically where you can't see the workers because there's so much dust. So that's really the scenario we're in now. We're in then. Now we're in situations, especially in tunneling, where we can't see the dust anymore, which is great. But silica, as we know, is invisible to the naked eye. So just because we can't see it underground, as we know, it's still above the old workplace exposure standard in some cases. So we still have a long way to go to get to the point where every workplace in Australia is safe and protective of this carcinogen.
Wonderful. I believe that's all questions that we have in the chat. We still have maybe 1 minute left, and we can spend maybe a few more minutes. If you have any significant question, you can leave it in the chat box. I have one question. The direct reading real-time monitoring instruments, some of them are claiming that it's capable of measuring silica quartz also at the level of the exposure limit. Have you had any experience, Kate, with this instrument?
Yeah, so I'm really supportive of the use of real-time monitoring, whether it's real-time monitoring for respirable dust or it's real-time monitoring for respirable quartz. Any ability or technology that can be used to give employers and indeed workers real-time feedback on how things are going is a good thing. It's never going to be as accurate as personal exposure monitoring, but that's okay. Because personal exposure monitoring is all about saying or determining if your controls are effective, right? Are they effective or are they not effective? Yeah, and it takes a bit of time. So I am really supportive. I really like, you know, some of the new equipment that's coming out, as long as it's used in a way that helps people make informed decisions and helps them make better choices to protect workers. Monitoring is only as useful as the people interpreting the information. So if you put a real-time monitor for silica dust on your site and you leave it there and you do nothing with the information, well, it's just a waste of money. But if you're taking it with you, you know, to see if, you know, you think that the ventilation system is working or you think everything's great, and you put a real-time monitoring instrument out there and you because of course silica is invisible, and you realize that you're actually, you know, at half the exposure standard or over the exposure standard, then you in real time can start to make some changes, you know, right then and there to help protect workers. So from that context, I am supportive of it. But in addition to personal exposure monitoring, to compare against the, you know, legislative workplace exposure standard.
Great. Quite a learning experience for all of us. And all of us appreciate very much the time that you have taken to share your experience with us. But more importantly, Kate, the work that you have done in terms of identifying the areas of concern, and more identification is easier task, but making an efforts to change the regulatory framework, that's a monumental task. And
Well,
I'm sure
it's not
there is a
done
long
yet,
way to
but
go,
thank you.
but you have been able to, you and the association has been able to do together an impact in that area also. So I would like to thank you on behalf of IOHA for taking time to share your experience and the work that you have done.
Well, thank you very much for the opportunity, and I hope everyone has a good day or a good evening or a good morning wherever you are. So thanks very much.
Wonderful.
Thank you so much.
Thank you so much.
Excellent presentation. Thank you.
Mm.